Hello, welcome to Public Health. My name is Rita Sethi. I'm the Director of Community Health. My professional background is that I am a registered nurse, and that sort of was my gateway into getting into public health. Once I got into public health and realized this was my passion and my life dream to sort of work in this type of environment. So in public health, being the Director of Community Health, I'm responsible for 3 program areas: the school health team, clinical services, and chronic disease and injury prevention. From chronic disease injury prevention perspective, we do a lot of work around policy development at the community level. So we work with other agencies in the community to help them develop policies that will impact our local communities at various levels to engage in healthy lifestyles. Basically, in the chronic disease injury prevention team and the school team as 2 particular areas, they work very hard to address the social determinants of health from very different avenues or venues. And so in the chronic disease and injury prevention team, we have a large number of our health promotion specialists that are out in the community working with community partners whose main mandate is to address things like poverty or to address things like education or community development, and they work with them to help build strong policy that is sound and appropriate for the population that they're working with. There's so many components that lead to chronic diseases, and when I speak about chronic diseases, I'm talking about cancers, I'm talking about diabetes, I'm talking about heart disease. And there's so many components that lead to those types of diseases, and a lot of them are public health related. And I'll use the example of diabetes, for example, where there is a bit of hereditary components to diabetes, but the larger component is your lifestyle, and lifestyle being eating healthy, making healthy food choices, and active living, so getting in your daily physical activity. And those are 2 areas that are very predominant in public health, because if we have a society where they have opportunities to make healthy choices and they have the understanding that it's important to make healthy choices around nutrition and physical activity, the likelihood is they're going to do that to better their life outcomes in the long run and prevent things like diabetes. Acute care generally responds to disease, so they will step in when a disease is present or when it is on your doorstep, and so they sort of come into play once your body has already started to feel the effects of an unhealthy lifestyle or an unhealthy environment, whereas public health is more upstream, that we want to engage people in activities to prevent that from happening altogether. Injury prevention is a component of the public health agency work that works with people of all ages to engage in activities or to participate in activities in a way that it reduces their chances for harm or injury to themselves or others. And so some of the components of our injury prevention team would be wearing helmets while you're riding a bicycle, and we work very closely with various organizations such as policing organizations and schools and other organizations that might be involved with people who ride bicycles regularly to create awareness around wearing helmets, but also to work with government agencies that create our legislation to enforce helmet wearing activities in certain populations. Another example is senior falls prevention, and so we work very closely with policymakers around built environment to ensure that when they're designing new communities, when they're designing buildings and things of that nature, that they're designed in a way to prevent falls, particularly with our senior population too, because we know that a senior who falls or who has a tendency to fall has a poorer life expectancy than someone who lives in an environment where that is greatly reduced. We have a harm reduction program, and we have a main focus on youth because we want to get them as young as possible, possibly stop them from heading down the path of using drugs or other substances. But also we work with the entire population as a whole. It's a whole philosophy or approach to addressing the issues around substance misuse or abuse, and it is trying to keep people alive one more day until they're ready to address their abuse or misuse issues, and things like handing out syringes, clean syringes, so that if they're going to be injection drug users, that they have a clean syringe to use. We hand out cookers or filters so that if they're going to smoke or cook their drug of choice, that they have it in a safe equipment, so that we can reduce the spread of diseases, but also improve the health of them as much as possible while they're using drugs, so that when they are, and the other part of the harm reduction program is to provide them with an opportunity to learn more about ways to get off drugs, to get supports in our community, and to access health care, so that we can work with them along their continuum of readiness to get healthier. We're very specific and targeted in the clinical services that we provide. The one piece that we do is we offer immunizations, and that would be our publicly funded immunization as well as travel, and that is to prevent the spread of diseases in our community. So we offer our routine immunizations as well as other publicly funded immunizations to everyone across the lifespan, as well as a travel clinic for people traveling abroad for a fee. The travel clinic is for a fee. On top of that, we also offer sexual health counseling, sexually transmitted disease infection counseling and testing, and birth control counseling and support. And the reasons why we have those is to prevent the spread of diseases and to increase the health of the populations that we serve around those key components. So preventing pregnancies and those that want to prevent pregnancy, helping those that have unplanned or unwanted pregnancies, and then those that are seeking some support around sexual health, and particularly around sexually transmitted infections. We have both young women and young men that would be attending our sexual health clinics, and if they were to come in, they would either meet with a nurse or a physician, depending on the type of appointment that they made and the day of the week they would make their appointment. They would meet with the individual and have a conversation about what is their reason for being there. It is a very supportive environment in which they would have testing if they needed it, the counseling around answering their questions, addressing their concerns in regards to sexual health or birth control or pregnancy, and receive the support and referral that would be required depending on what the nature of the visit was, to seek other supports in the community. They are a very open and engaging team of professionals that are in our sexual health clinics that would work to meet the needs of the individuals coming in a non-judgmental, non-stigma environment, and very open to whatever lifestyle you come in with. School health is a very interesting and dynamic program. We work with elementary and high schools in all of our areas, and we have a couple different components. The one component is under the legislation around Immunizing School Pupils Act, and what we do is we ensure that the kids in our school system are all vaccinated against the publicly funded vaccines, which would include your routine vaccines as well as hepatitis B, meningitis, and HPV. On top of that, they keep records of those individuals who, for whatever reason, health-related reasons or conscientious objectors, who don't have their immunizations up to date. So in the event there's an outbreak, we can protect those individuals in that particular school or setting. The other component that we have is we have nurses in our high school and all of our public high schools who are offering clinical services similar to our clinical services team around STI counseling and birth control support, as well as some immunization support. And then we have an entire team of nurses working in both the elementary and the high school around health promotion strategies that would include healthy eating, healthy or physical activity, and other components that would address having a healthy lifestyle. We have staff that sit on the Poverty Task Force and work within their local community to ensure that people are knowledgeable about the Poverty Task Force and people understand the reason for the Poverty Task Force being in place, and look to find ways or venues to come to the table to support the work of the Poverty Task Force. I think as a new employee starting with public health, I think it's really important to keep an open mind to how broad public health is, and to understand that sometimes you're sitting at your desk and you're doing one bit of work or another bit of work, and you sometimes question how important is this in this grand scheme of things. And it's basically the nature of public health is such that you may not see the results or the fruits of your labor today. You may never see them depending on how long you work in public health, but at some point or another there's going to be an impact, and it will be a positive impact on someone's life. And so to always have that in the back of your head as you're moving forward.